We'll get started here this morning, and I will call the St. Paul City Council Budget Committee to order. We're closing in, as we've mentioned, week by week, closer and closer to the date we pass the final budget. Our intention at this time is to pass a final budget on December 8th, if we can get there. And so in the meantime, we have been hearing from departments and particular programs and initiatives in advance of the 8th of December. So we're very clear on what we are voting on, and if there are adjustments or changes we want to make, that we have that information in advance of our vote. We did establish a levy limit of 6.9% way back when in September, and we've continued to work on seeking ways to lower that number in addition to combing through our programs. So this morning we will be hearing from our fire department with a follow-up on the rapid response team pilot. We discussed this very briefly during the fire department's budget presentation, and what request was to give them a couple months to flesh out the details on this program so that they could present a full and robust presentation around what their initiative looks like. And then following that presentation, we will hear a presentation about the low-income homeowner support program. I'm reading that, so I know it's right today, and also in advance of our budget, just to make sure that we're clear on the details of that particular program. So we're going to start today with our fire team. The chief, Butch Inks, is in the house, and he'll get us started. And then we'll move on to the presentation. We have until 11:30 this morning. I think we'll probably finish earlier on time, just given the materials that we got in advance. Two presenters. I'll just, if this works for you, I'll keep my eye on colleagues, and so you can just run your program or through your presentation. And then we'll look for natural breaks and ask questions. And if we ask a question that you're coming to in a slide or two, feel free to just say, I'm going to get to that, and we'll be patient. So, but in the meantime, welcome, Chief Inks. It's wonderful to have you here again.
Good. Here we go.
Take it away.
Thank you, Council President Brenmoen and the rest of the City Council. I appreciate taking the time today to hear our presentation and our operational plan around the rapid response team and what we have labeled the community advocacy response team. As mentioned, we presented our general budget a while back, and this was part of it, and promised that we would come back a couple months later to have an operational plan flushed out, and we feel we have been successful at that. And so thank you for the time and the extra time to develop that plan. And what we will present on today will ultimately show you our operational plan and ideas, but we'll also talk about how we arrived here, where this idea came from, how it fits into our core values, as well as our mission statement, as well as the mayor's core pillars. We'll talk about what partners we worked with to develop this, as well as best practices around the country and in the region of what this program should look like. And then show you the operational plan, as well as what the $600,000 investment will look like. So with that, Chief Sampson has been the point on this project from the inception, and he will be doing most of the presenting today, and we will answer questions together as they come up. So again, thank you so much for the time. And with that, I'll pass it off to Chief Sampson.
Thank you very much, sir. Appreciate it, Fire Chief Inks. Council President Brenmoen, distinguished council members, on behalf of Fire Chief Inks and the women and men of the City of St. Paul Fire Department, I want to thank you for the opportunity to further discuss Fire's vision for the general fund investment for the creation of the rapid response team. As Chief Inks alluded, we're calling it the Community Advocacy Response Team, and I very much appreciate your time today. So without further delay, we will jump right into the presentation. Next slide, please. As the agenda slide before you details, today's presentation will briefly hit on the fire department's mission and core values, as well as Mayor Carter's core pillars, and one of them in particular, that being the Community First Public Safety Framework. These components will provide background and additional context, as well as justification to how we as a city, and specifically the fire department, envision providing an alternative response service to our community whose needs simply are not fully being met due to a myriad of complexities. So next slide, please. Thank you. So the St. Paul Fire Department protects the people of St. Paul with public education, fire suppression, rescue, and emergency medical services. We partner with the community to mitigate risks and respond to calls for service with skill, dedication, and compassion. And then the St. Paul Fire Department's core values. And as you can see, the acronym PRIDE, which stands for professionalism, respect, integrity, duty, and equity, truly represents fire's core values. And it really is kind of Chief Inks' standing order to all of our personnel. Simply put, these are the expectations, and they provide guidance on how we are expected to operate and truly serve the public in every one of our interactions. Next slide, please. Now, this leads us to Mayor Carter's 3 core pillars, one being lifelong learning, the economic justice and inclusion, and then the third is the community first public safety. And it's really this community first public safety framework that we'll expand upon a bit more to provide additional context and background for our program specifically. Next slide, please. Thank you. So Mayor Carter's vision for community first public safety, or the CFPS framework itself, is ultimately comprised of 2 parts: how the city responds to crimes and crisis, and how the city can proactively make investments in hopes of preventing them in the first place. It was through this approach that Mayor Carter went about establishing a CFPS task force whose mission was to help guide our city's efforts to not only define, but ultimately deliver a true model of what community first public safety could possibly look like. Next slide, please. So the task force, or the CFPS commission, was comprised of a diverse group of 48 individuals named by the mayor's office, representing a wide array of agencies and perspectives that also included designated representatives from the city of St. Paul, including St. Paul Fire, as well as from Ramsey County, that really kind of served as resources for the commission throughout the entire 6-month process. The work of the commission itself was mostly focused on how the city responds to crimes and crisis, which in return would ultimately help our city craft a better model for emergency responses, as well as crisis interventions for our most vulnerable residents of our community. Next slide, please. So as mentioned, the CFPS Commission provided recommendations for skills as well as resources for our city's first responders to better optimize the outcomes, not only for our community members, but as a byproduct for our first responders as well. As the image before you shows, the commission ultimately landed on 5 major areas of desired impact: the decriminalization of behavior and response, the focus on both prevention and community safety, to improve systems and increase accessibility, a more efficient deployment of law enforcement, and 5, a more appropriate responders for each situation who can best assist those in need. So how exactly does the fire department fit into this framework? Next slide, please. Well, it's with these 5 areas of desired impact in mind that we'll discuss how we envision St. Paul Fire to fit into the big picture. Now, as our mission and core values state, the fire department proudly serves the residents of all 7 wards in a multitude of ways that go beyond just fire and EMS resources. That being said, the last few years have seen a dramatic increase in overall call volume. 2020 specifically was a record-setting year for run volumes for our department, obviously heightened by the COVID pandemic and the civil unrest in the wake of the killing of George Floyd, both of which have had and continue to have a profound impact on our personnel and our department's operations, let alone our city. Now, 2020 was a record-setting year for our department with just shy of 44,000 calls. That said, our overall run volumes for 2021 are up just over 11% from the same point in time 1 year ago. And our current trajectory means that in all reality, our department is looking at responding to over 55,000 calls for service to our community just this year alone. Just for additional perspective, 2011's total run volume 10 years ago topped out at 30,700 calls for total service. So in 10 years, we've increased our run volumes by 179%. Now, in efforts to manage this dramatic increase in calls for service, our department has implemented measures to help aid in the overall increase in runs. We've added a medical resource to the city's east side with the creation of an additional responding ALS unit. We've incorporated more super medic companies, and we've also implemented a basic life support response and transport model. This service in particular has helped both our community and our department by responding to what are deemed lower acuity calls with a more appropriate resource, which in return allows our advanced life support medic units and fire apparatuses to be available for what are deemed higher acuity calls for service, whether fire or EMS based in nature. And we're proud to report that this service delivery model has been so successful that just recently we have expanded the operational tempo of this program to 7 days a week. Now, there's a multitude of reasons that our run volumes are trending as they are, but certainly one area in particular that we are more aware of than ever is it with our homeless unsheltered population. Next slide, please. Obviously, the COVID pandemic continues to bring strain to our community and our department in many immeasurable ways. And in particular is how often we are responding to the needs of our homeless unsheltered populations, which previously was very, very difficult to track. But in working with our city's OTC department, as well as our contracted run data collection services, we've been able to start tracking just how often we are engaging with the demographic within our community that historically has been underrepresented, and as well as, quite frankly, just incredibly challenging to fully serve. Now, as this slide shows, over 11% of our overall run volumes checks the homeless unsheltered box, if you will. To put that into perspective, at 50,000 calls, which we just rolled over to the other day for service to date, that equates to more than 5,500 of this year's fire and EMS calls alone are directly attributed to someone that's living homeless for whatever reason.
Chief, just a quick break. It looks like we didn't advance to your slide, or at least I'm still seeing the one with the 10% and 12%.
Yes, ma'am. Yeah, the 11% that I mentioned is kind of an average of the EMS call, as well as the fire calls at 12%.
Okay, I just didn't want to make sure that we forwarded it to your next slide. If we didn't, so thank you. Sorry to interrupt.
Very much. Thank you, Council President. So on that note, we will jump to the next slide, please, Holly. And that's really kind of where the opportunity presents itself. So now we know that the impact that the homeless unsheltered population is having for our operations is significant. But the fire department is not alone in recognizing this issue. And the response from the city to include other departments is the mayor's office, DSI, Parks and Rec, Public Works, the police department, to address the myriad of needs has really, really been very impressive, and one that we're honored to partake in. However, and as our run numbers really indicate, the city of St. Paul and the fire department in particular continue to be challenged with optimally addressing the needs of its community members that really fall outside the normal scope of traditional police, fire, and EMS calls, or the first response. Next slide, please. So it was through this analysis of the data, along with the input from our crews that are so heavily impacted by these types of calls, and with open communication and coordination of our community partners and providers, and ultimately through the proposed additional investment, that we as a department are proposing a program that ultimately will yield an end result of an enhanced delivery of service to our most vulnerable and under-resourced populations. And the next few slides will detail some of what we envision as the fire's community advocacy response team, or the CARE team, what that will actually look like. Next slide, please. Thank you. So collectively, we want any investment in our department to ultimately be successful. And Chief Inks has committed his available resources to focus on researching how this team can best be built to deliver a more optimal service to our community. And what you see listed here on this slide is a snapshot of some of the programs that have been engaged with directly to gain more insight into those that are already out there that are serving in a similar capacity. Programs such as Eugene, Oregon's Cahoots, which at over 30 years old is credited as one of the original and most successful alternative social outreach programs in the country. Seattle Fire Department's Health One program is also listed here. Another incredibly successful program whose makeup and expanding mission is providing an amazing template from which to model the vision for our program. Now, each of these outreach efforts has been met with incredible enthusiasm and oftentimes really kind of yielded further resources that have created a snowball effect of information and confirmation that what we are trying to implement here within our department is being established with known best practices to better ensure a more successful program and therefore a more optimal delivery of services to our community here within the city of St. Paul. The last thing that any of us would want to do is the rushing this program to failure, and we are confident that both the time and efforts being invested on the front end are going to result in a greater chance of success when it comes to actually getting our alternative response team for the city of St. Paul, the CARE team, fully up and running. And on that note, I want to mention 4 of our community providers in particular. Chris Michaels from Catholic Charities, Andrea Hindeker from Safe Space, Molly Jalma from Listening and Freedom House, Nick Giese from the Union Gospel Mission, several of whom are on this call today. But we sincerely feel that if this approach and ultimately this team are going to be successful, it will be founded in the strengths of its partnerships and through the incredible network of resources that are already available here within the city of St. Paul. These organizations and these individuals in particular are truly the local industry experts, if you will, and have been incredible resources for our internal work group here at Fire. And we look forward to continuing the partnership with them, with all of them, and are grateful for the outstanding work and the organizations do for our community every day. Bottom line, we are taking this opportunity as well as the additional financial investment incredibly serious, and for several reasons. We feel passionately about addressing not only the current, but the underlying needs of our most vulnerable and traditionally underserved populations through a more optimal delivery of service, as well as reducing the lower acuity or non-emergency calls for our frontline responders. Next slide, please. So we are proposing an alternative co-response team that will deliver the assistance needed with an emphasis on quality, compassionate, low barrier care, and without precondition. This highly trained two-person response team will be comprised of a social advocate who will specialize in navigating the available systems and resources to simply advocate for the individual's well-being, coupled with an EMT who will be able to assess and potentially address any acute as well as any underlying medical issues through the advocating for the overall health of the individual of concern. We anticipate this team will be able to respond in real time or on a referral basis for further assessment and treatment and follow up through case management while maintaining a provision of outreach supplies such as food, clothing, and other materials, and with the ability to potentially transport to alternative destinations to include home, clinics, urgent care, shelters, day centers, or sobering facilities. The team will have a heavy presence within the local community provider space and ultimately partake in the care coordination, documentation, proactive outreach, and the tracking of its clientele. Next slide, please. So really the linchpin to the success of this team will hinge on the creation and implementation of the care team coordinator or manager position as the next phase of this approach. Beyond being the direct report for the response team members themselves, this position and this individual would be responsible for continuing the work in researching and developing how to best deploy the actual CARES team itself. The coordinator will ultimately be responsible for hiring, staffing, overall program goal and direction, and the day-to-day organizational management for the team. This coordinator will also be responsible for communicating and coordinating with our partnering agencies and community providers, as well as reporting up data deliverables to the chain of command for not only accountability purposes, but to ensure that the intent and the mission of this program and our department is being delivered with every single interaction. Next slide, please. As previously mentioned, the care team's coordinator and/or manager, as well as the actual team itself, will fall within the fire department's operational structure. This approach would streamline several things, but it will allow for the care team to build from the fire department's resources, reputation, and the trust already established within our community from the beginning. Streamlining of the medical services through the continuum of care, easing of the referral process, simplifying the tracking of resources and data, all while, again, ensuring that the fire department's mission and core values continue to be delivered. Next slide, please. So we know that the city of St. Paul is heavily invested in the betterment of our community, especially as it pertains to our homeless and sheltered population. And the work that DSI's homeless outreach program, along with the police's COAST program in particular, are doing to serve the most vulnerable members of our community is immeasurable. But ultimately, we feel that the care team will have a similar mission, yet unique in its makeup, so that this team will also provide an essential service and collaboratively work with the other devoted resources within the city, county, state, and as well as at the federal level, along with our philanthropic and community providers, whom all kind of operate within the same space. And we wholeheartedly feel that the CARES team will ultimately be successful due to its ability to build upon and collaboratively operate with these other partners, opposed to simply duplicating services that may already be out there. Next slide, please. So now this last slide captures the proposed funding streams to support the St. Paul Fire's CARES team pilot project for 2022, that also includes SPFD's operational budget, the opportunity for specific grant funding, as well as the additional investment from the City of St. Paul's general fund. Now, as mentioned, from the very initial conversations around this topic, Chief Inks has recognized and made a commitment to ensuring that this team is built upon a foundation of known best practices that will ensure its future success. As previously discussed, he tasked several administrative deputy chief level officers internally from both the fire and the EMS side to start the process for performing the research and making the vital connections that will truly ultimately streamline the implementation of the actual team itself. Additionally, the mayor's office has been in collaboration with the POLAD Foundation for a grant that would provide an additional $300,000 for 2022 with an additional $300,000 for 2023. This money will allow the team to capitalize on the expertise and the resources of our community providers to assist in creating and hiring of the actual social advocate positions within the co-response team itself. And the proposed general fund investment of $600,000 will in return be utilized to procure the vital coordinator role, as well as augment the BLS division and pathway program with the additional resources and training needed to help build out this team. This investment will also be utilized to purchase the necessary materials to physically stand up the team, to include the purchasing and ongoing maintenance for response vehicles, as well as other necessary logistical items vital to providing this service. And we sincerely feel that the vision of this program is one that will benefit not only our fire department and our fire and EMS responders by sending a more optimized alternative co-response team to our most challenging clientele and community members, but also our community as a whole by addressing and targeting our responses to our most vulnerable and oftentimes just under-resourced populations. We are taking this opportunity and the investment itself incredibly serious, as we wholeheartedly know the need and, quite frankly, the potential benefit for both are very, very real. But so is the financial investment, and one that we fully appreciate. Next slide, please.
Before you move ahead, it looks like it's perfectly timed. Ms. Naker has a question, and you were just about to pull that famous question slide up. So, Ms. Naker, fire away.
Thanks, Council President. And yeah, Deputy Chief, if you did have any comments on the question slide before the question, feel free to say them. I don't want to cut off the ask for questions with a question.
Council President Brimoen, Councilmember Naker, this is absolute perfect timing. So thank you, ma'am.
Great. Well, thank you so much for the presentation. And one of the things that I heard loud and clear in what you were saying was that there's been a lot of thought put into this program, I know, over a number of years, and I appreciate that. I think our council has repeatedly asked for investments to be backed up, not just by hypotheticals, but by really data, looking at other places for best practices and working with the stakeholders you mentioned. And I'm really glad that you called out the community partners who've been part of this, because you're right, they do amazing work, and they know the work firsthand. So thanks for being so inclusive in this process. I have two questions, one more granular and one higher level. The more granular question is just about the funding. So my understanding, as you said, I believe, is that the general fund dollars, $600,000, are being requested as a match for the POLAD grant of $600,000. And to me, that's great. That's leveraging outside philanthropy with our dollars. But you said that the POLAD grant was $300,000 for 22, and then another $300,000 for 23. And I'm curious if our $600,000 match then is just for 22 and nothing for 23, or if why I guess we're not being asked for $300,000 this year and then another $300,000 next year. So that's one question. And then the higher level question is just, you mentioned all of the different community partners who are occupying the space of providing services that are not police services and not necessarily medical services to our most vulnerable residents, which I completely agree is the unanswered question that we've all been grappling with for some time. But you also mentioned not duplicating the services they're providing. And I know we have the Police Coast team, we have many nonprofits who have street outreach teams, we have the rapid response team that we've talked about, and maybe this is the same thing as the rapid response team. But could you talk a little bit about how this new team won't duplicate the services that are already being provided?
Council President Brimoen, Councilmember Naker, thank you for the questions. The first question specifically on the funding piece, yes, that is correct. The POLAD grant, the way that it's defined is spread, the $600,000 is the total award. That's going to be spread out between 2022 and 2023. Now, the initial investment of $600,000, I have to, full disclosure, we fully anticipate that this program is going to be successful. Otherwise, we wouldn't be as committed and invested as we are right now to really trying to tee this thing up because we know that the potential is there and it's real. So the investment itself, I don't have the full depth as far as whether this is going to be a line item, but I fully anticipate if we are able to generate the data that we're successful in this request, we're able to generate the data that provides the justification for this team, there will come a time, probably in the near future, that we're going to be requesting additional funding or modifying the budget so that we can try and further build up this team, just because we believe that in its soul wholeheartedly. And we've witnessed this and encountered this with other agencies that we've reached out to. They've started with a very small budget and a small mission profile. And then from there, they've been able to justify it because of the return of investment. And so that the future where we at are in 2023 as far as the general fund investment, I think that's to be determined. But I fully anticipate that a year from now, if we are at the point where we're asking for additional funds, we're going to have the data that the team's able to generate to provide both the qualitative as well as quantitative numbers to really kind of drive home that point and make the additional request. Does that get you a little bit closer, ma'am, to what you're looking for?
Yeah, I appreciate that. And maybe as a follow-up, it would be good to sort of see more line item detail as to how, because it sounded like at first it was, I was imagining that it was $600,000 from us, $600,000 from them, and so roughly a $1.2 million budget total. But now what I'm hearing is maybe it's more like $900,000 this year, $900,000 next year, and then maybe more in the future. So it would just be good to understand how our dollars are planned to be spent.
And Council President Brendmoen, Councilmember Naker, that is certainly something that we could flesh fully out. And full disclosure, we are really hinging the future of this program on that vital coordinator role, that kind of phase 2 to this phased approach that we had mentioned. And that coordinator is going to help us kind of really dive deeper into how we expect and anticipate to utilize the budget and the funding that's being proposed. So on the second question, the duplication, the concern for the duplication, and I want to be fully transparent, that's a concern of ours as well. But the one thing, at a face level that St. Paul Fire brings to the table is that medical component. Not only the medical component, but we have the data to show that right now we are going on an incredible amount of runs. And that incredible amount of runs is taking its toll. We're coming on the heels and we're still in the midst of a pandemic. The run volume numbers that I shared with you, it's not astronomical, but it's incredibly high. And anything that we can do to deliver better services, similarly aligned with the BLS delivery of service, where we are able to kind of target and hone in on lower acuity calls and send the appropriate resource there, that leaves our front line, our ALS, our higher acuity level response vehicles and apparatuses, that leaves them in service and available for our community. And that also lessens the burden or the toll that it's taking on our members. So as far as the duplication of efforts, I am not concerned about the duplication of efforts. As our, 10%, almost 5,500 calls to date this year alone is checking the homeless box. We are still in that space, if you will. We are still responding to those calls, even though that there are other teams that are operating in the same space. So kind of that one slide, I believe before this one, like our efforts are to align missions with those, the Coast Unit, Ramsey County, DSI's efforts. We want to align with them so that we are ensuring that we're not duplicating efforts, that we are taking an approach here that bottom line serves our community and also serves our department with the benefit of sending a more optimal resource.
Thank you. Just looking to see if that answered your question, Ms. Naker. Ms. Prince.
Thank you, Council President Brendmoen, and thank you, Chief Sampson and Chief Inks for this really, really good presentation. One question I have is, so if I'm understanding this correctly, we're working with the outside agencies for disposition of these cases, and how many social workers are we planning to hire for this effort to be part of those calls with the EMTs?
Council President Brendmoen, Councilmember Prince, thank you for the question. It really is going to be determined with the partnership with our community providers and then what they are able to kind of essentially scale out. We envision the team to, again, be comprised of a social advocate, someone with that kind of like social response, the direct lived experience, if you will, but really it's that critical piece, that person that knows how to navigate the system. So I think our partnership with our community providers, some of which we listed before, as well as other agencies that may be out there, I think is going to help determine what the actual makeup and then therefore like how we are going to expand upon the makeup of that team. So how many people are going to need to be hired, obviously are going to be determined by the budget and the investments that are made within our department. But we fully anticipate the actual makeup of the team to be one EMT, again, internal to fire, as well as the one kind of contracted social response worker. The coordinator position will land within fire. And that coordinator position is really going to be that kind of, I use the term linchpin, but that common denominator that's going to allow us to have the direct oversight and reportability, as well as give the team someone to report to, and then be that individual to liaise with our community providers and our community partners.
So if I'm understanding it, then the social workers won't be social workers that we hire and keep on staff, but they will be contracted from the agencies that you mentioned. Is that what I'm understanding?
Yes, Council President Brenmoen, Councilmember Prince, that is what we're proposing at this point in time. Again, the fully fleshing out this team is going to be really, it's going to become more transparent, or it's going to be more apparent once we get that coordinator position into our department, and then that's their sole mission, is to flesh this thing fully out. But yes, we anticipate, and the benefit there is that we're capitalizing on our area and our local experts that kind of operate 24/7 within this field. And then, so we instead of onboarding a select group of people and then having to instill that upon them, they already have that from the get-go. And that's really, as soon as the wheels hit the road, if you will, or the boots on the ground, that's what we want. We want this team to have an immediate impact from day one of being in service.
That is really good for me to understand, because I had been under the impression that we were going to be hiring social workers, and I think it's much more appropriate for us to be working with social workers from the agencies who are trained and knowledgeable and work with the populations that we will be serving. So that is that's good news to me, because as we talked about yesterday a bit, one of the things that I am very mindful of with our work in this area is that the county is actually the jurisdiction among all of us in the city that is funded to do human services and mental health services and public health services. And I want to be to be really clear that we are not getting into an area of endeavor that that just simply is not part of our huge mission of serving the city of St. Paul. So this is really good news to me that these will be contract positions with agencies that are very knowledgeable and equipped in these areas. The other thing I want to say is how much it means to me. I think I told you, Chief Sampson, today that that your passion for this work is so evident, and it's something that when we have talked about this, the issue of unsheltered people is definitely in terms of long-term care and managing casework is definitely a county function, but it falls into the city's responsibility when it comes to that first response and that initial response, and that this is a commitment to get people to the right endpoint so that they can get the ongoing prospective help and services that they need. Makes this really appropriate in terms of how I see this unfolding. So I want to thank you for the good work you've done in putting this together, and just to stress to my colleagues that I'm relieved that this is not, I don't hear anything today that makes this sound like our taking over the county's work. So that is a relief to me, and I appreciate this presentation.
I appreciate your that last comment, especially Ms. Prince. I know that we have often, raised issue with with, am I muted?
Oh.
Raised issues with, just staying in our swim lane and recognizing that everyone has a role, and our property tax levy and services are separated the way they are for a purpose. And the thing that really brought me around on this program in particular was when was presented to us initially as in recognizing that our role is first response. And this is first response, and then but it also is a better outcome in the longer term if we do a better job on our first response. And it just I don't know, for some reason that really clicked with me. It's like that is our role, and we're trying to figure out how we can. I mean, we talk about this with our police department as well. It's like our goal is to have the right people answer the right calls for the right thing, and not like basically bring out a sledgehammer to deal with something that's more like a push pin issue. So I really appreciate this thinking that we're doing in terms of dispatching the right folks for the right job. So I do think that is our role, and I also appreciate that we're also handing it off then afterwards to the right folks. And I do want to just take a pause and thank the folks who have joined us today. Chief Sampson called them out individually, but also we see you. We appreciate that you're here on the call, and the partnership and the work you do is valued deeply by those of us on the council and the city. And I know you're not presenting today, but I just want to acknowledge that you're here and we appreciate you. Ms. Yang has a hand up.
Thank you. I wanted to echo that it would be really helpful to see like some sort of visual or line item breakdown for like this year through 2023. And overall, like I feel the care team vision that you shared, it just brings me so much hope. And I love the name itself, because I feel that doing this work from a care perspective is truly what it takes to be able to resolve and support folks who are struggling the most in our communities. And we know that it's actually like support, like through many social services that they need in order to be able to get back on their feet and be able to, get dignified housing or even a stable lifestyle as well ahead of them. And I know how important having something like this available would be, especially for folks who connect with me and say, like, I'm really worried about even calling the non-emergency or emergency line, because I'm worried that, there might be very punitive actions coming for whoever is homeless that I'm meeting and wanting to help. And so I want to say thanks for here echoing. I want to say thanks for your work, and I'm really supportive of this. I know that it's something that would have been super helpful, especially when we had the spike in homelessness during the pandemic. I was out there talking to folks and was really wanting us to also have like a multiracial, multilingual team out there as well. And so I know this comes much later down the road, but wanted to emphasize how important it is to have that, to close those language gaps, especially since we know that there are many folks who come from different backgrounds who are homeless, and we definitely saw that here in the East Side.
Council President Bremoen, Councilmember Yang, thank you for the kind words, and thank you for the vision of how we could augment this program for even better results. We couldn't agree more. The fire department in particular, as you can imagine, as our numbers show, we are involved within the homeless communities constantly. We are out there responding, whether on the medical side or on the fire side, and we are deeply committed to the betterment of our community. And that's why we're so passionate about this program, because there's nothing more frustrating for us as first responders to go on a scene and not have the skill set to us to be able to truly help what's going on for a particular individual. So the homeless side of things is certainly one facet of it. The other side is just we have vulnerable populations that are sheltered. But that also demand resources. And again, our skill set as first responders, we go. Someone calls, the tones go off, and we respond, and we do that every day. And that's what's not unique about the fire service, but that's what I'm so proud of our department in particular, is the passion that they serve. But there's frustrations. When we start seeing the same individual 3 times in a single day, there's an underlying issue that's going on that we're not able to meet. And that's really how we see a benefit of this team. This isn't the other facet or the other side of the coin for this response team, is that we have the ability to inject a resource to try and figure out what the underlying issue is to possibly prevent that need and get them the services, whether it's our aging, populations that are aging, but just unsupported within the house, or whatever the other issues might be, that we can get them the resources that they need.
Thank you. Ms. Naker.
Thanks, Council President. And Deputy Chief, I'm glad you brought up that point about seeing the same people over and over again. I actually had meant to ask about that when you showed the numbers earlier, just wondering what percentage of those high percentages are repeat calls to the same individuals who, if we could just figure out how to help them on an ongoing basis, would not be continuing to call 911 for your services. And so I would just, it's not a question, it's more a comment or a suggestion that my hope is that this team, this coordinator, allows us not just to better respond every single time to the same person, but to figure out and hopefully bring to us, bring to the county, bring to other policymakers. These are our suggestions for how to really help these people who are in need.
Council President Brent Moen, Councilmember Naker, thank you. Yes, there are statistics that we have for certain addresses and for particular individuals, and it's that collaboration with the OTC that's as well as like the agencies that accumulate our run data. That we can kind of really parse that information out. But that's one of the facets of this team that we're really excited about, is essentially the ability for our responders to commit someone to like a referral process. So if we're going to the same address 6 times in 1 week, which happened last week, like we have to be able to inject a different response model. We have to be able to get them a different service to try and prevent that from happening again, and really figure out what the underlying problem may be, and to devote the correct resources and response to those kind of calls. Because like I mentioned before, our responders go and they do so passionately and they do so every single time. But it is frustrating for them as well to know that they're going to the same person and just not have the tool within their tool bag to really, be able to inject something that's going to prevent that call from happening again later that day or later that week.
Great. I mean, we know what a time resource that is as well, and we hear about that again to the other public safety and public works in our parks crews. When we are responding to one person repeatedly, we're not responding to other calls for help and support because of the opportunity cost there. So I think this does get at that. I do want to say, and this is a compliment to the fire department and also just kind of reflecting on where this program has been in the past, but one thing that I really like about this proposal is that the initial work will be in and under fire's supervision. And I think to me that assures me that it's going to start happening now and not, I know that we are talking a lot about Office of Neighborhood Safety and the elements of that, but it still really kind of remains a vision. We don't have we haven't hired a person to lead that Office of Neighborhood Safety. And I feel like if we waited until that was established, that we wouldn't get this going. And I think that one of the reasons why I am supportive of this program is because it sounds like we're going to hit the ground running, that you'll be able to do the initial phasing right away and get work in action and build off of your rapid response work that you've already done to get this going. And so, because I don't think any of this work can wait. I don't think it can really wait till January, to be honest with you. But the sooner we get started, the better. And I just have a lot of confidence that with within the fire department structure, that this position will thrive and get off on the right foot. And if we expand to a point where this belongs in a different, under Office of Neighborhood Safety, or if it needs to move in the future, it will be off to a good start. This is like ECFE, like get them off to a good start. So I really do like this. And I do think, I hope you hear some trepidation from the council members, just because this is the third time that we've tried to kind of launch this thing. And so maybe one thing we can do is have a regular check-ins with you in terms of how's the research going. Who do we hire for this position? What are things looking like? Has the budget changed since we've established this? And doing a regular check-in, because I know we're very committed to this, and we also recognize. It's poignant, and it's something that is impacts us all winter, all year long. And so I do feel good about where we're headed with this, but I also do feel like checking in a few times in the early part of next year to see where we're at would be helpful. And at the same time, I would say that mostly because I have confidence that the reports back will be great. Are there other questions, concerns, or comments from my colleagues? I also do, I really appreciate, I know this gets us kind of late into our budget season, but I do appreciate that you've had the opportunity to really flesh this out and come back to us, like I said in the beginning, with a program that we can wrap our heads around. It's been too much of just a notion in the past, and this does feel like there's some real concrete plans around it. So I appreciate that. I see Mr. Tao has a hand up.
Thank you, Council President. Chief, thank you for the presentation. I was just curious, as we're very excited about this program, overall, how are the frontline folks or the firefighter, how are they feeling?
Council President Bremoen, Councilmember Dow, thank you very much for the question. Again, as I kind of alluded to, I'll speak from, I'm not that far from responding. I still operate in the capacity as a district chief. I'm relatively recently been appointed into my current position. And I can tell you firsthand that it's frustrating not having a skill set to provide the help. That's why we're here. That we are in this line of work to help people. And every single one of the members of our fire department, was hired to deliver service to our community, and they're passionate about that. But again, there's frustrations when we show up and the only skill set we really have is to talk to a certain individual. They either have a problem or they don't, but then we return to service. We either take them to the hospital and then we return to service. We put the fire out and then we return to service. And we know that there's a lot more underlying a lot of times on these particular calls that we just are not well enough equipped to really, really handle. And that's why I think there's excitement about this team. There is a sense that this really, if we were able to show up and say, hey, this person needs help that we unfortunately just can't provide right now, let's refer them to this other process. We send that team, like I heard the analogy of, we are pulling people out of the river. Every day we pull people out of the river. Well, it's time, excuse me, it's time we go upriver and find out why people are falling in the first place. And that's really what we see this alternative response model to be. It's that ability to interject assistance and resources to identify what help these people may have and collaborate with what resources are out there. So I think overall, the ability, similar to our BLS division, the BLS division itself has provided an immense service not only to the community, but also to our department. And that's what we envision this team will do for our responding personnel as well.
Thank you.
Great. Any other questions before we shift gears? All right. Thank you very much for the presentation here today. It was great to hear from you, and this gives us fodder as we move forward to our final date. Chief Inks.
Good. Council President Bremoen and the rest of the City Council, I just wanted to say thank you for allowing us this opportunity to flesh out an operational plan and just touch on a couple of things in closing. I think the common theme with this presentation and this approach is we were very intentional to not take the path of duplication, and very intentional taking the path of collaboration and collaborating with our internal partners as well as our external partners. Internal being police, DSI, our emergency management division with Director Shute, the mayor's office, yourself, and external with our partners that are on the call now. And the ultimate goal of simply delivering the appropriate resource for the appropriate call, I think can sum this program up very, very easily. So again, thank you for the opportunity. And as always, given the opportunity to thank the women and men of our fire department, they're doing tons of good work out there. As Chief Sampson mentioned, we're over 50,000 calls already. We've broken the record. They come to work every day to serve the residents of St. Paul, and I'm, as the chief, super proud of them. And thank you for your support.
Thank you so much. We appreciate you and your team very much as well. All right, with that, we will move on to our next presentation here this morning. Thanks to the fire department, and we will hear next from about the low-income homeowner support program. Looks like, I'm trying to guess by who's, Casey, are you taking this one away, or is it Madeline?
I will share the presentation. So if you want to make me and Madeline will kick us off.
Okay, we will. Let's just make sure that you are a presenter. So you should be able to present now. There you go. Welcome.
Thank you. Good morning, Council President Brenmoen, council members. Thank you for having us here today. My name is Madeline Mitchell. I am a senior budget analyst in the Office of Financial Services, and I am here with Casey Wiedrich, the Financial Capability Manager in the Office of Financial Empowerment, and we will be presenting the Low Income Homeowner Support Program that is included in the Mayor's 2022 proposed budget. So at the highest level, this program is designed to give $500 annually to our lowest income homeowners in St. Paul to help with housing expenses. This program came out of a desire to be responsive to what we were hearing from constituents, telling us that they value city services and want to see them maintained and expanded, and constituents telling us that the property tax portion of their housing cost burden is difficult to manage. And since we cannot tax people at different rates, we see this program as a way to capture market value and maintain city services while also providing flexible assistance to those cost burden property owners, specifically in areas of concentrated poverty. The budget for this program is $600,000 in total, with $500,000 allocated for payments and $100,000 allocated for administration. The budget is located in the HRA, and the program will be managed by OFS and OFE. And then on the bottom there, the statute that we have been considering while crafting this plan grants housing and redevelopment agencies the authority to provide decent, safe, and sanitary dwellings for persons or families who lack a sufficient income.
Great, and I will take over on this slide. And so we've designed this program to provide that $500 in direct assistance, but we also want this to complement the existing resources that exist in the community. So we want to use that $500 sort of as a way in to accessing these other supports if that folks aren't already doing that. So we want to sort of provide awareness around the property tax refunds that exist and support people in filing for those, and also connect people to additional benefits that they might be eligible for that they may not be taking advantage of, such as energy assistance, which we think that most homeowners in this program would also qualify for.
Yeah, so as Casey just mentioned, a really core component of this program is that connecting participants to existing benefits and not duplicating them. This slide shows some of the existing property tax relief programs provided by the state of Minnesota that the program would help participants access. The regular homestead credit refund is the first one on the list. There is the most robust, both in terms of the take-up rate and the benefit provided. Approximately 21,000 St. Paul homeowners took advantage of this benefit in 2018, and the average refund was around $1,100. The Department of Revenue estimates approximately 2/3 of eligible homeowners in Ramsey County take advantage of this program. Based on the eligibility requirements or recommendations that we will go through in the next few slides, we anticipate that all applicants for the city program will also be eligible for the state refund. The next on the list, the special homestead credit refund, is the one you can get if your property taxes have increased more than 12% and at least $100. This program is essentially transitional aid, helping with that first year that your property taxes increase. It's also much smaller than the homestead credit refund, and fewer people access it. The last one on the list is not a refund, but a deferral for senior citizens. This is far less utilized than the other programs, but still an option for seniors with an income below $60,000 who have been in their home for 15 years. The city's program is distinct from these programs in a number of ways. First is that it's simply more targeted to the lowest income homeowners in St. Paul. The second is that the payment is not a property tax refund, but rather flexible funding that can be used as needed to assist with a variety of housing related costs. It's not a loan, and we are hoping that we can structure it to make access as streamlined as possible. We'll talk more about that in a bit. And finally, is the additional support and connections to other benefits that will be provided as part of this program.
Yeah, and just to talk a little bit more about the need for it, just want to share some of the data on housing cost burden for low-income homeowners. And here we have data on the homeowners at the income levels that we want to target in this program, 30% of area median income or 133% of federal poverty level. And you can see here that 80 to 85% of homeowners at the income level are housing cost burden, meaning that they're spending 30% or more of their income on their housing costs, which include their mortgage, utility costs, but also include the property taxes. But if you look at the numbers for severely housing cost burden, which means they're spending more than 50% of their income on housing costs, it's 64 or 65% of the homeowners at that level. And if you compare that to overall for St. Paul, it's only 6% of all homeowners are housing cost burden. So we really do want to target these lowest these lowest income homeowners that are really struggling with their housing costs.
And here is that slide from Ramsey County that we've all seen in past presentations. This shows that the areas with the most market value growth in recent years, which also tends to translate into significant growth in property taxes, are the 4 highlighted in yellow: Dayton's Bluff, Payne Phalen, North End, and Thomas Dale. And then on the next slide, we can see that these also happen to be the areas that make up a really large portion of St. Paul's areas of concentrated poverty. And within our areas of concentrated poverty, the majority of households have a property value between $150,000 and $300,000, meaning a city tax bill of between about $600 and $900 and a total tax bill of $2,400 to $3,300. While this program is not a property tax refund, we think this is helpful context to understand the ways that property taxes contribute to overall housing cost burden. And to sort of model the impact of a program like this, we have a few sample properties here. On the left, you have the market value, and then towards the middle, you can see the total tax bill. The first red column shows the homestead credit refund from the state that this program will help people access. And then in the green column, and keeping in mind that property taxes are only a portion of the overall housing cost burden, you can see that even after accessing the state program, many homeowners still face pretty significant costs.
All right, so now we want to transition to talking about the eligibility criteria for the program. So as I said, the primary eligibility criteria would be the income levels. We want to target households at 30% of area median income or 133% of federal poverty level, whichever is greater. And I'll talk a bit more in a coming up slide about why we want to use both of those income guidelines. We also want on the property side, we'd want the property classified as a homestead, which means it's owner occupied and it's the owner's primary residence. We don't want to put long requirements for how long people have lived in their home, but we do want to just stipulate that they live there throughout the property tax year. And then for location, we want to target that the homeowner is located within the area of concentrated poverty. However, I think in sort of talking through this pilot, we've been thinking through that we want to explore the option for if there is a homeowner that lives outside of an ACP, that they could also be eligible for the program, but we would target first the homeowners in the areas of concentrated poverty, and if there are funds that are remaining, we could open it up to homeowners living in other parts of the city. So here is what that income guideline would look like using sort of both of those together. So this is what we would be the public facing the income guidelines for that. And we want to use both of these for a couple reasons. The first is to streamline administration for the program. We want to use categorical income eligibility as much as possible, which means just asking folks if they're already receiving benefits that we know means their income qualifies for our program. So using that 133% guideline means that, for example, it'd be any adult that receives medical assistance, or most adults that receive medical assistance, we would know that they qualify for this program, or households that receive SNAP. So that would, both streamline administration and also just sort of require that homeowners who are applying don't have to give us a lot of paperwork. And here are the demographics looking at those two different groups. So we estimate there are around 4,000 homeowners that would income qualify for the program. in the city of St. Paul. And here, sort of, you look at the demographics by race and ethnicity and age, sort of opening up to also include those households that are at 133% or 133%. And apologies that the way the census breaks the data down, it's at 130%. We want to use 133% as our guidelines because that's the Medicaid income guideline. But we can see here that opening it up for that population, you know, sort of opens the eligibility up for a higher number of homeowners of color, and also for younger homeowners, where if you go to the 32% at this income level, it's very much, in the largest group is seniors, and this opens up to a larger group. And we've got just a few more slides to go through. So in terms of the administration of the program, we would want to do a rolling application for this program. We're thinking around timing the communication of it around the property tax bill communications and deadlines in the spring, and then going into the fall. We want to do primarily an online application, but also have paper application available for folks that don't have internet access. We also want to explore the ability for people to apply by phone. And in all those cases, we would also want to translate all of the materials and support folks in the language where possible. And this would be taxable income for homeowners. So we will require collecting W-9s from participants. So we have to see how we can do that with the least burden to the city and to homeowners. And for income verification, we do, similar to what we did with the People's Prosperity Guaranteed Income Pilot, really use self-attestation. So the categorical eligibility, and if they don't already receive benefits, do a simple income calculations. And then we can also help to do a property search to verify their location and that the home is actually homestead. And for payment process, the option that we are leaning towards is a prepaid card option. So it wouldn't require that the participant have a bank account, and the card that we've accessed previously, it's a very low fee for recipients. And again, just to say, this money is coming through the HRA, the money would be intended to be spent on housing related expenses. Just to talk a little bit about outreach strategies. As this is a new program, we do think we'd need to do a significant amount of outreach to, raise awareness for the low-income homeowners. So we want to take a couple different strategies. We're thinking we could do some direct mail to homeowners in ACP areas. We want to have a website and social media, but also sort of work with community-based organizations that are already serving these folks. And again, as we talked about, we want this program not just be providing the assistance, but connecting people to these other resources. So really thinking through, how do we connect them to and promote the property tax relief that they can get, the other public benefits programs, perhaps connecting them to like the Ramsey County navigators that can help them see what all benefits they connect for. And again, additional city programs. So if there's a College Bound eligible child in that household, we want to make sure that they're signed up for College Bound. And that is our overview, and we are happy to take questions. Thank you.
Great. Thank you for the update and presentation. I see Ms. Prince has a hand up.
Yeah, I have a few questions. So does the $600,000 in the budget include the program administration? So how many, if I saw Madeline nodded, so so how many, I mean, if you do the math, it's 1,200 families that would qualify, but if admin is coming out of that, how many homeowners would qualify?
Council President Brenmo and Councilmember Prince, the $600,000 program budget has $500,000 for the benefit itself and $100,000 for administration. So with that $500,000 amount and a $500 benefit, that's approximately 1,000 homeowners. With our estimated 4,000 homeowners who would income qualify for this program, that's about a 25% take-up rate, which we think would be pretty good on a program like this, especially in the first year.
And I appreciate that, but I have some basic concerns about it. For one thing, so we can serve about a quarter of the people who would qualify for it. So right away, we're going to have winners and losers in this program. Then they get it, and it's taxable. So, you know, depending on their income and so forth, then they don't realize the full value of the money that we give them. And then a $600,000 program is, I don't know, a third of a levy percentage. So we're effectively raising taxes to serve 25% of the people who might qualify for this and giving them a taxable benefit. It just doesn't make any sense to me at all. So I'll just put that out there. I mean, it's nice for those 25%, but I think the pain of people being priced out of their homes through property taxes is such that I think this will be a cold comfort for the people who can't get in on the program or fall just outside of the qualifications or whatever. I mean, when I'm door knocking as a elected official and I talk to people who are being priced out of their homes by property taxes, and as you point out, Dayton's Bluff is one of the areas where that taxation is really hurting people. This is not, I mean, I appreciate that you're looking for a solution, but I think this is such a marginal benefit that it just doesn't make sense to me.
Thank you, Councilmember Prince. I appreciate the concerns you're raising, and I believe we shared with the mayor's office and others that we also heard from Ramsey County, and I think this was presented early, that we leave $25 million on the table with the regular income tax returns, and those look like big benefit in the $1,000 range. And I'm really interested in the work that Ramsey County is doing around engaging folks in applying for that state money that is they're entitled to, and that is probably going right back into the general fund as opposed to being paid out as it was intended. I'd be curious to know what third of Ramsey County is not applying, you know, what eligible third is not applying. And I would reckon to say it's probably in St. Paul, and I probably in areas at least I know I represent. So I share your concerns, and I appreciate you bringing them up. I also appreciate the acknowledgement that it would be a great benefit to those few folks that would get it, but at the cost, it does give me some concern as well. So I would just appreciate the thoughtfulness in your comments. At the same time, appreciating that trying to problem solve. I mean, we have to throw everything we can out there, but I do have concerns about this one. I see Ms. Naker has a hand up, then Ms. Jalali, then Ms. Yang.
Thanks, Council President, and thanks so much for the presentation. And I think I share some of my colleagues' concerns that have already been expressed. I'm just wondering whether this is the best use of staff time and resources. Looking at the presentation with the amount of eligibility verification and just the back end work that would be needed, we know that we struggle to get dollars out the door in some of our other programs that we've launched. And then, as Council President Brenmoen just pointed out, there are millions of dollars at the state and county level that are untapped every year. And it seems like a better strategy to help people access those dollars rather than creating a new pool of money that they may or may not apply for also. And then Councilmember Prince's point about the irony of raising taxes to lower taxes does strike me as something to think about. So I guess what I'm wondering is, if we feel strongly that this is the solution, has there been consideration about applying for grants or other philanthropic dollars to pilot something like this rather than, again, raising taxes and making this an ongoing general fund expense?
I would say thank you, Councilmember Naker. Thank you, President Brenmoen. It has not been a part of our discussion to apply for grants for this. And if I can make one comment to Councilmember Prince's comments, which I appreciate, I think we do also hope that over time we could bring the operating costs down, sort of like as we take this first year, sort of as an evaluate the way that we're getting out there, and that we can streamline as much as possible, that we could have more of those funds going to direct assistance to homeowners and bring that cost down of administration so that we could serve more than 1,000 homeowners. But again, I think the approach we've taken is that this being a sort of program that would exist in the city going forward, that we hadn't thought about doing a pilot and looking for grant funding for it.
Thank you. Ms. Jalali and then Ms. Yang.
Thanks. Thank you so much for giving us some additional and updated information on this. I just wanted to express some points that I think are good to keep in mind with this program. I think that this is a unique proposal in that one is uniquely serving kind of a equity area and issue that I'm not sure other city offerings are doing right now, which is helping homeowners who are longtime residents, often an overwhelmingly residents of color, in neighborhoods that are under displacement pressure like many other places, and who don't have income flexibility or support and are burdened by property taxes. And I know that with the budget conversation, we're always trying to figure out, like, how do you raise the levy and tax folks who have even said, hey, we want our dollars to be put to good public use, but then also be mindful of impacts at people at the very kind of bottom of the tax rungs. And so in terms of just the targeting, I agree with it, and I think it makes sense. I think that this is what I envisioned the Office of Financial Empowerment doing from the moment we were first talking about that office, because it was about recognizing there's millions of dollars available to community members who really need them, who are passing it up. They don't know about it. Applying for it is complicated. It's overwhelming. There's stress interacting with the government, like in general. There's a lot of, there's language barriers, all these issues. And to me, kind of the power of this idea is that we're not just saying, here's some direct assistance, although we should be welcoming of that. And I think that's good as a value. That's not bad. And I think that the fact that this slide alone is really spelling it out, like, here is the opportunity to reach folks. It is a lot easier to get constituents to care about something if you are actually like concretely offering them something. And to me, the sort of dual strategy of, here is literal direct assistance you can have. Here's money that you need. Also, you can get even more money. Here's 3 other ways. And I'm a trusted messenger now because I'm reaching out to you. I'm directly helping you, and then I'm helping you know about these other things. So the potential to just amplify what right now is underutilized is something I think is really important to keep in mind about this. The fact that there are lots of unused funds out there is kind of why I think it makes the case for why this is important. So personally, I really support this idea, and I think it has a lot of important design aspects that matter. So those are just some thoughts I wanted to offer, and I know others want to speak to. That's it for now, but just things I think we should keep in mind. Thanks.
Thank you, Councilmember Jalali. And I do agree. And in some ways, I think I might maybe be even more interested in a program that was the administrative piece of this, the staff piece, to just go out and do the shakedown. Let's get folks signed up for the existing programs as opposed to and add another program, because we know that there's a missing piece there. I 100% agree. We need to get these dollars to people. I'm just worried. My personal concern is just setting up another program that we have to get out the door. But I do agree that it's meeting a certain niche. I was wondering, could the person who's running the PowerPoint, I think it was Casey, if you could back it up a couple about to the slide about this one. I think it's overwhelmingly white homeowners that this program are eligible for this. And so that is the other thing too, is I know I'm interested in making sure that we increase home ownership in our BIPOC communities, at this point in the city of St. Paul, so many of our homeowners are white, and that doesn't mean they shouldn't get these types of resources allocated to them, but I don't want to present this as a program that would overwhelmingly benefit people of color. I think this graph at least tells me that it still is overwhelmingly would overwhelmingly be benefiting white homeowners. So again, I agree with your points about getting those resources out the door. I wonder if it's a program that was just talking about how do we partner with the state and Ramsey County and the other nonprofit partners to make sure that the resources are not left untapped and that our St. Paul community members get them. So it's kind of adding to your comment. Ms. Yang.
Thank you. Well, to the staff, I had a really great time meeting with you all yesterday, and I wanted to uplift some of the things that I brought up in our conversation. Because with this slide here, Council President Brenmon, I did also notice the same thing that you pointed out too, with a large chunk of the homeowners who would qualify identifying as white. And I feel that really is indicative of the disparities that we've always been talking about in home ownership, and why we need to make sure that we are, finding ways to make homeownership affordable and accessible to folks who, are people of color. Regardless, though, this slide also shows us the folks who right now are current homeowners who are struggling the most. And that's what really matters to me. And so I feel it's really important to name that we're already operating in a very classist system where no matter what your income is, we're all paying the same amount in taxes. And that is something that really needs to change. I'm a really big supporter of making sure that folks who are making more are paying more in taxes. And that's really why I support this program. I feel like, this is a really great way to make sure that we have a way to support folks who are heavily tax burdened. When I'm out talking to folks in the East Side here, like honestly, the most common issue that comes up is people talking about how burdened they are by property taxes. And I wish that I had something to be able to share with them about what the city is doing to support them. And this is a really great way for us to be able to do that. To some of the points about us raising taxes and then doing this, and that being problematic, I feel like this is actually a really great step to us making sure that we have a way to support folks who are tax burdened in our communities, while also finding ways to connect them to other resources available through the county, through the state as well. This program here isn't catered to renters, which is why I said to the staff yesterday, who are also on the call here, that we also need to be making sure that we have a dual operation at the same time, which is catered to renters and really is educating them and providing them the opportunity to get their tax return as well, which, as you all know, at the county, there's a lot of folks who aren't getting it already. And so that being said, I just can't express how important it is for us to be able to have a support program like this available. I think that for folks who, I guess it's really frustrating to just even hear some of the pushback about this, because if you've never been in a situation where you have experienced housing instability, or you've been going through home foreclosure, you just don't really understand how significant a single dollar is to you. And that's coming from me as somebody who experienced home foreclosure just 2 days before my own high school commencement. And so when I think of the payment here that we are wanting to make available to folks who are living in areas of concentrated poverty, to me, I know it's going to make a significant impact for them, more than what we even realize. And so I think that it's important to center them and their experience and what would they want us to say in this moment right here. And so I'm really talking about my own lived experience here, knowing that what I've experienced in my life is also it's like a common thread to what other people are experiencing in their own lives too, about housing instability. So I will leave it at that. But, I think just to end this off here, I feel like the conversation here is not about we're not doing enough, so let's not support this, or let's not fight for this. I feel like we need to really change the narrative of what we're holding and actually say, how can we do more? How can we pull in more resources to support all of the people here on the slide, but also outside of the areas of concentrated poverty too, because as you know, within housing, there's always been a historical push around making sure folks who are living in poverty are living in is the same area, same neighborhood, and you know, we're experiencing so much redlining already, and we've talked about how racism is deeply intersected in that. But we also know that there are people who are low income who are living in other parts of who are living outside of these areas of concentrated poverty too. So I have a really deep interest in making sure that we are also making this program available to them as well and inclusive of them. And so I'm looking at the cup half full here, and I'm really committed and want to make sure that we actually find the funding that we need to support all of the folks that really need this.
Ms. Prince.
Thank you, Council President Brenmon, and thank you, Council Member Yang. I think that one thing I'd like to point out is I think there are other ways to get at this. For example, I have been working with a senior who downsized. She moved from the home where she raised her family into a smaller home because she couldn't afford to maintain the large home anymore. She couldn't afford the taxes on it. She's in the smaller home, and it turns out now that she is also having problems because she lives in a part of town where the taxes have gone way up, that because she's only lived there a couple of years, she can't get the tax deferral that seniors are entitled to. So I have put her in touch with Director Karcher Ramos, and we are working together on getting that change, getting the law changed so that she would be able to qualify for that senior deferral. The other thing is the special tax refund that we've talked about here is really confusing and complicated. I have gone online to try to walk people through it to help them figure out how to get it. And the directions on the Minnesota Department of Revenue website are so confusing and difficult that I myself, if I didn't get help filling it out, I don't know that I would do it. So what we used to have at the state level was something called limited market value. It was part of the Minnesota Miracle. It went away sometime in the early 2000s, but where it actually gave you a break on if your home had increased in value while you lived there, which happens to all of us, that our homes over, the house that I live in is about 4 times more valuable now than it was when I purchased it. So my taxes have gone up commensurately. But what we used to have was this limited market value calculation that was done on our taxes so that we didn't have to pay for the full appraised value of our homes. I believe that's what they substituted the special tax refund with. And I think there needs to be a way that we fight for this at the state to find a way to have people get some kind of relief that they don't have to apply for, just based on if your property value has gone up some enormous amount over a period of time, you shouldn't have to pay for the full tax on the full market value, because you're not realizing any of that increased value until you actually sell your home. Now, this is really complicated, and I hate to talk about it in this way because it sounds complicated, but it's something that we could be doing. The cities in the metro area, the whole metro area, we could make a very strong case for going back to some kind of limited market value. I think the problem that I have, Council Member Yang, is I have that same experience that you do with talking to people in my community about how much their taxes are impacting their ability to stay in their homes and deal with their family budgets. The problem I have, and I know you think that it's a good program no matter what, is how would I pick 1 out of 4 of those households to decide where to give this money? I think the difficulty is that it's going to cost the people that don't get it increased taxation so that we can give it to 1/4 of the people who qualify for it. So that's the problem I have with it, is city programs should not be picking winners and losers. And I really I think there are other ways to get at this. Also, to the point that Councilmember Naker made, that maybe we look at something like grant funds to help people stay in their homes when their taxes go up like this. But I think this is a statewide problem, and we should be looking for solutions at the legislative level.
Yeah, and I totally agree. The conversation that we've had in the past at GIPTAC and other places where we talk about property taxes is exactly what you said. It should be automatic. We shouldn't have to do outreach to tell people that they're qualified for these types of refunds. It should be at the bottom of your tax form when you're filling it out. So it is a real shame, and I feel like it's by design. I mean, the intention is for people to not fill out those forms, and shame on the legislature for not correcting that. I know we brought it to their attention. It should be something on our bonding priorities. It should be automatic. I mean, I think that is the solution. And I do just want to take a moment. I've heard something that I've heard a few times, but I just want to be clear. You know, when I ran for office 10 years ago, I ran really because of my life experiences. For folks who are newer to this council, you may not be aware that I grew up in public housing in a single parent family, rented all the way through when I was in high school, rented, paid my way through college and rented, and I've rented really the majority of my life. I have experienced these things firsthand. When my mom bought her first house, the mortgage rate was 11%. And it was a very challenging time for our family. And so I understand. And the other thing is, I worked at the Minnesota Attorney General's office for 11 years as a mediator. And the number one issue that we dealt with was around home ownership and landlord-tenant issues. So housing is hugely important to me, and it comes from my own life experience as well as the experience that is shared with me on the doors. So my questions about this program are not because I don't have deep, concerns and connections to this issue, but more because I want to make sure that we're being effective with the resources that we have here at the city, and I want to make sure that the money is distributed as effectively and efficiently as possible. And that's our responsibility here as we look through the budget. This does not feel like it's ready for prime time as far as I'm concerned. The thought is correct. The program I have concerns about, and I do think that Ramsey County at long last seems to be taking up this issue and is very concerned about the inequities of how the rental refunds are returned for Ramsey County residents. They're working at the IRS, they're working at the state legislature. I think we should partner with them on that work and do our best to have all these refunds be automatic rather than inventing a new program. And I'm just sharing where I stand on this, and also to be clear that this is rooted in my own values and personal experiences, and I have not been sheltered from that. So any other questions about this program? We can stop sharing the screen. All right, Ms. Yang.
Thank you. I have a question for John McCarthy. I was wondering, would you be able to share in terms of funding, like where else we would be able to find funding to support the program if we were talking about covering all of the folks who were on the slideshow earlier? I asked about ARP funding yesterday and was told that it wasn't ideal to use ARP funding because we wouldn't have it for the next few years, for any following years. But what are the different avenues that we would be able to go to get funding for this?
Council President Bremon and Councilmember Yang, it's a great question, and one that we did kind of deliberate over as we were putting together the proposed budget around ARP, and you noted the challenge there is that it is one-time funding, and our goal here was to have this be, an ongoing sustainable program. And that's really the same challenge that we've faced with philanthropic funding. If we could get, it is a new concept and it is really kind of in the government space, so it does feel like it might be a challenge to get philanthropic support for something like this. And if we were to be able to do it, it's likely that most funders would provide shorter term or one-time funding. And so really, as we were putting together the proposed budget, this was really the way we arrived at, an ongoing, continuing, general fund allocation for this. I do want to circle back a little bit to the comments that Councilmember Prince made, and those are also kind of key in our formulation of this program, is that the existing programs that are available to St. Paul residents all have pretty fundamental flaws built into them, and we tried to really make sure that the program that we created addressed those flaws. You mentioned, Councilmember Prince, if you downsize and you're not in your home for, I believe it's 15 years, you're no longer eligible for that senior deferral, which is a gigantic problem in that program. The special benefit or the special credit is only available on a one-year basis when you have a year where your taxes increase dramatically or your value increases dramatically. So once it's at that higher level, you're no longer eligible the following year, and so you kind of fall off of that benefit. And then the regular sort of homestead credit, we've talked about making that automatic. The challenge there is that it also is income-based, and so there's this. I think some of the challenges that we have there is that it has to tie your property tax data to your income tax data, and there aren't systems currently that do that. The county obviously manages the property tax data, the state manages income tax data, so it's very hard to make those connections in our existing system. So fully agree with everyone that we should be absolutely advocating at the state to improve these programs and with the county and our partners to improve the existing programs. But in the meantime, there's a real gap for our residents, and we tried to make this program as easy as possible to apply for and to be eligible for, so that it for the folks in these targeted areas in the city with very low income homeowners would be eligible for an additional benefit beyond the ones that exist right now. And the other thing I'd note is that, OFE is managing this, and they have a great track record with getting funding out the door with other similar programs and working with community partners to get these resources out to the people who most need them. But would love to be able to, to your point, Councilmember Prince, expand our ability to spread this benefit to more folks. I think we'd like to start at this level, and maybe it's something that if it's successful, could look at expanding in the future.
I see Ms. Prince has a hand up. Mr. McCarthy, do you know, though, quickly, I feel like there is, I understand that there needs to be an income, the income needs to be connected to the property tax value. I mean, like there has a connection that is sort of separate from your income tax filing and your property tax. Although the rental return credit form can be automatic if you're, it seems like just given the way that we're moving with taxes, that there are ways to if this, then, the second question is that, and it's not impossible to make that connection, right?
Council President Bremmo, I think that's right. And I think some of the e-filers, like the TurboTaxes of the world and stuff like that can build in those. It's the challenge is if you're not someone who's able to pay for those services, or you're having, your own challenges filing your regular income taxes. The other example we know is folks are eligible for the earned income tax credit, and lots of people leave that on the table too. So there's lots of benefits that aren't being taken advantage of, and we'd like to, use this as an opportunity to spread the word on all of those to our residents.
Yep. And I think, that's underscoring my point earlier, is just I think the work needs to happen. I just wish we could use the state's money that's already earmarked for it to pay for it, for the actual benefit side of it. Ms. Prince has a hand up, and I do want to just say we need to adjourn at 11:45. So let's find closure here in the next 10 minutes or so.
Thanks, Council President Bremmo, and thanks to you, Mr. McCarthy. I definitely think that with the value of real estate going up pretty much everywhere that we're at a point where this is not just a city issue, it's probably happening all over the state, and that we may find a more supportive audience going forward on how we help people deal with these increases in their property values, which obviously are a really good thing, but are really difficult to live with. But I guess the question I have is, so you are saying, and I hear you, I agree on the special property tax refund that that's a one-time fix. I guess I didn't realize that. I mean, if your value continually goes up a lot, you get to apply for it each time you would qualify, I'm guessing. And that's something we're just seeing the growth of property values in Dayton's Bluff is just like, in the North End and around the city is just they're going up like crazy. My question is though, this is a one-time $500 assistance, or does this stay with?
It's in the general fund. It would be in the general fund.
Right, but does it stay with the homeowner that is getting it each year? I mean, that I guess is what I'm confused about. Do they qualify? If they continue to qualify, they continue to receive it? Or do we seek new applicants every year?
Council President Bremmo and Councilmember Prince, the idea is that folks would need to reapply every year, and we can reach, but you could be eligible to receive it every year as long as you stay within the income eligibility threshold year after year.
But you wouldn't automatically get it.
You wouldn't automatically, but we would, right, and we would likely, reach out to those the same families that were that had previously received the benefit.
I mean, that in itself may be somewhat problematic, because when we know we have 4 times as many people that qualify than can actually receive it, if we would be giving it I think that's something we have to come to terms with, is that if somebody's going to get it every year while the remaining 75% never get it. So just another difficult piece of this, at least for me.
Thank you, Ms. Prince. A lot of the items that come before us are challenging. I think that one thing that I can say is that the administration and council continues to seek ways to address the challenges that face our community members. And there's always a push-pull on these things. So I appreciate the conversations here today. I do truly appreciate this council's ability to talk these things through and to recognize the ups and downs of things as we move through this process. So I appreciate the comments and questions and feedback here today. Does not look like there's more questions. And as I mentioned, we probably need to wrap up. We're a bit over time at this point anyway. So I'd like to thank folks for presenting this morning. Is there any last words from our presenters, or is a thank you sufficient? We appreciate you and your work very much. Wonderful.
Yeah, thank you very much.
Thank you for having us.
We appreciate you. All right. Shifting quickly to our budget. I was going to call you guru. But so switching to Ms. Houston, just to give us a roadmap of where we're headed here in the days ahead.
Council President Bremmo and council members, thank you. That wraps up our scheduled budget committee meetings for the time being. I suspect in a couple weeks we will be meeting to discuss any adaptations that the council is wishing to make to the budget prior to the Truth in Taxation hearing on December 1st at 6 p.m. And that is all in preparation for the vote on the budget is scheduled currently for December 8th. And I will be gathering feedback and survey information to get to everybody. I sent out a preview last week, but we'll do some analysis myself on that to summarize the data that we're hearing for the
Ms. Houston,
feedback
can you
here.
remind us, we had a significantly higher, I think you may have mentioned this last week, but a significantly higher response rate on the survey this year. Went from something to something.
Yes, last year we had about 160 responses, and this year we're close to 300.
That's great. You know, and the more we hear back from people, I think the more that sample size is gives us some real feedback we can work with, and I appreciate that you'll be looking through those 300 responses and coming up with some of the top things that we're hearing, but also the information as a bill both for council members and staff to take a look at on their own time as well, and just see what our engaged community members had to say to the survey. So, so we also, let's see, next week is Thanksgiving week, so we will not have a budget meeting or a council meeting or an HRA meeting or a library board meeting or any meetings for that matter, but we will reconvene again then in December, and we have our work cut out for us as we go to the final budget vote. So if there is nothing else to come before us this morning, thanks, Holly, for your work in preparation for today, and to our presenters, and we will be adjourned. Thank you, folks.